superior region of the skull, commonly known as the forehead, is called the frontal bone. The frontal bone is the portion of the skull above the eyes and includes the forehead, the upper orbits, and the superior region of the nasal cavity. Derived from Latin, frons, or forehead, the frontal bone is clam-like in shape, with a long circular upper border and a shorter inferior margin at the top of the nasal bone. Both sides of the frontal bone have identifiable characteristics that serve as important components for brain function and protection. Separate sutures divide the areas of the skull to separate some parts from others. The frontal bone in particular is designated by the coronal suture, which separates the frontal bone from the two lateral parietal bones, and the squamous suture, which separates the frontal bone from the two lateral temporal bones. There are 12 other bones that articulate with the edges of the frontal bone, including the ethmoid bone, the sphenoid bone, the nasal bones, the two lateral parietal bones, and the two zygomatic bones. The region of the frontal bone extends down into the superior plates of the orbits, the superior nasal spine, and the upper parts of the zygomatic processes. These areas of the skull separate the frontal bone from the nasal bone, the temporal sides, the sphenoid bone, and the ethmoid bone. Near the edge of the frontal bone are the supraorbital foramen. The supraorbital foramen are located on the supraorbital ridge beneath the frontal squama, or forehead region. The supraorbital foramen are important holes that act as passageways for nerves and vessels to run through, like the supraorbital artery and the supraorbital vein. While some skulls may have supraorbital foramen, other skulls may have supraorbital notches or indents. A notch is formed when the edge of the foramen extends through the boundary of the orbit. Similarly, an individual may have a notch above one orbit and a foramen above the other. Beneath each supraorbital notch is a depression called the trochlear fovea, which is found on the medial superior side of the orbit. The trochlear notch holds the orbital trochlea, which acts as a pulley for the superior oblique muscle of the eyeball. The frontal bone continues down from the trochlear fovea and extends into the border of the nasal bone. On the lateral sides of the frontal bone are the zygomatic processes. The zygomatic processes of the frontal bone are the parts of the zygomatic bone that extend laterally and inferiorly from the front of the frontal bone. The zygomatic process forms the superior lateral border of the orbit and inferiorly articulates with the bottom of the zygomatic bone. In the middle of the frontal bone is an area called the glabella. The word glabella is derived from Latin, meaning smooth. Centrally located beneath the arch of the eyebrows, the skin covering the glabella is soft and hairless. In newborn babies, eye, or orbicularis oculi function, can be tested by gently tapping on the glabella, stimulating a primitive reaction called the glabellar tap reflex. The glabellar tap reflex shuts the eyes when the individual is tapped lightly between the brows. At birth, the frontal bone consists of two halves, separated by the anterior fontanelle in infants. The frontal bones ossify together to form a single membrane from two primary ossification centers slowly over time in the years following childbirth. The anterior fontanelle allows the skull to be compressed during labor and re-expand for brain development after labor. The anterior fontanelle typically finishes ossifying together at about 2 years of age. The time at which the anterior fontanelle ossifies is extremely important, as it can result in a birth defect called craniosynostosis if the fontanelles begin to form prematurely, resulting in an abnormally shaped skull. Within the frontal bone is an area called the frontal sinus. The frontal sinus contains a membrane filled with a mucus lining. The size and shape of the frontal sinus varies within individuals, but generally reaches its maximum around the age of puberty. While infants do have sinuses, they do not begin to fully develop until at least 1 year old. The frontal sinuses in particular cannot be seen in an X-ray until about 5 or 6 years old. Interestingly enough, a very small percentage of the population does not have a frontal sinus. On the interior side of the frontal bone is the anterior cranial fossa. The anterior cranial fossa is a major landmark of the frontal bone. There are two obvious depressions on the surface of the frontal bone that houses the frontal lobes of the brain. These two orbital plates contain the medial cribriform plate, and together with the lesser wings of the sphenoid bone, describe the anterior cranial fossa. Together, each component of the frontal bone contributes to a wide range of important functions, including breathing, facial support, and brain protection. Additionally, the frontal bone is a useful aspect of human anatomy and physical anthropology because it contains numerous distinctive characteristics that give insight on the development of the frontal skull from birth to adulthood and its connection to other axial regions. This video on the frontal bone was prepared as part of the course requirements of human anatomy at Saddleback College.